Hi everyone, my name is Dr. Bill Owens and thank you very much for joining me in this short video. One of the big questions that I get across the country when I consult is, how to implement an electronic medical record and what should the expectations be. And I struggled through this in my own practice. I've been practicing 15 years and I've used an electronic record system for probably the last 9.5. So I really honed this over the years to the point where getting proper documentation into the system is minutes, and it stands up to every aspect of scrutiny. But it also really reports on my expertise and what I'm thinking about with the patient. Now, there's going to be a couple other series of videos that I'm going to go into that and how and why that's important. But for this one today and right now, what I want to talk about is what your expectations should be. What's considered normal? If you have a busy practice and you have staff and maybe you don't even use an electronic note system, maybe you just use the billing system. Maybe you use a billing system with a note system, but you're not happy with it. It doesn't matter. I'm not really here to talk about electronic systems and give you the difference. I can certainly discuss with you the one that I've used over the last 9 years, and we can go from there with that. But the most important concept is that you understand that implementing an electronic record is a process. It's a process that takes time, and to be honest, it's going to take you about a year to do. And it's a year to do because you're going to implement it in steps, and you're going to offer a path for your staff and for yourself so that you're not upsetting the apple cart, so to speak, in your own practice. Because remember, you still have to see patients, you still have to bill, and you still have to collect, and you still have to manage your practice and your staff. So you can't throw in a change immediately. It has to be a process. Now remember that if you accept Medicare patients, the federal government is requiring an electronic health record by 2015. If you don't have an electronic record by 2015, they will start to penalize your reimbursement. So, all that stuff aside, that's important, but the truth is, if you want to work with the medical community and you want to be accepted as a peer provider, you have to have a note system that's legible and organized. That's it. And you have, as far as the people that I consult with, you have no choice. So when you're implementing your EMR, here's a couple tips that will really help you. Now, one of the things that when I consult with doctors is I help outline a EMR implementation plan specific for your practice. And it doesn't matter what EMR you use, it works with all of them. But the process is key. And there's 3 important parts of that process. The first process is understanding that you have to make that change to begin with. You can't be wishy-washy with it. That's the biggest problem with implementing a healthcare record, is you sort of decide that you maybe kind of think that maybe you should. And that's what turns into a long, stressful process without any authoritative decision-making. So deciding you need the EMR system is important, and it's key. Second is discussing this with your staff at a level that allows the implementation to move smoothly, okay? And in that second stage, you have to understand that your staff has a job and you have a job. Each side of what you guys implement is unique to your role. You're the doctor, their staff. They have very unique and important responsibilities, as do you. So you're not going to be able to delegate this implementation solely to your staff. You still have to be the general. And thirdly is, and this is critical, is how you integrate an EMR system into your existing patients. And what we do is very simple. When you have an old system and you have a new system, you're going to keep all of your existing patients in your old system until they all get released from care. The new system is only going to take the new patients that come in and reevaluations. So what's going to happen is you're going to start and you're going to have an old system. Then you're going to decide to have a new one, And for a while, at the beginning you only have one, and at the end you only have one. In the middle, you're going to have two. You're going to have the old one, and you're going to have the new one, and there's going to be a transition. And that transition is very smooth, and it's very easy. It's completely, well, I shouldn't say, it's not going to be completely stress-free, but it'll allow you to get better at what you're doing, and your reporting will really be able to stand up to scrutiny. Your staff won't quit, and you won't have a stroke. So if you have questions on implementing an EMR record in your practice, I've done it with practices that have used travel cards only. I've done it with practices that have implemented multiple EMRs and just weren't satisfied. So I've pretty much seen it all, and I've known what offices have gone through, and I can help you. So if you have questions, feel free to email me or call me. The best way is to email me, but my information is below, and I look forward to talking to you. Thank you.